Good day, dear friends. With you is Natalia on the Doctor Online channel. Today we will talk with you about a cheap drug that has two very important effects. Vasodilating and sedative. Should you keep it in your medicine cabinet? Can it help us in a difficult moment? And how not to harm yourself with constant use of this drug? So, in what cases can we count on the help of Validol? First of all, it helps to relieve neurotic heart pain. It copes beautifully with nausea and vomiting if you get motion sickness in transport. Some people take nitroglycerin for heart attacks. At the same time, they often complain about a headache that occurs after taking a nitroglycerin tablet. So, a Validol tablet placed under the tongue can help you solve this problem. Take note of this. This drug has not accidentally reduced the respect of people suffering from cardiovascular diseases. Its components are quickly absorbed into the bloodstream, and within 3 to 5 minutes, the concentration of this drug in the general bloodstream becomes maximum. And within 5 to 7 minutes, each of us can feel the effect of its application. Those who have used a wheelchair more than once confirm its effectiveness and speed of action. Did it make you nervous again, and did it pinch in your chest? Put a Validol tablet under your tongue. Does your head hurt? Start with Validol. In most cases, it does a good job with a headache. If you can't sleep for a long time feeling a sense of anxiety, turn to this drug for help. To this day, according to statistics, Validol is among the sales leaders, despite the fact that disputes about its effectiveness, which have been going on for more than 100 years, are still ongoing. Many of you are interested in the question of how exactly the effect of taking Validol is achieved. First of all, it is based on the reflexive action of the drug. A Validol tablet placed under the tongue irritates the nerve endings located in the mucous membrane of the oral cavity. This, in turn, stimulates the production of biologically active substances, and primarily histamine. It relieves vascular spasm, expanding their lumen. This is especially important for the heart vessels, as their constriction leads to insufficient oxygen supply to the heart muscle, which is accompanied by the appearance of painful sensations in the chest, and as a result, headache is reduced. The lumen of the brain vessels is normalized, and the production of endorphins is activated. They have an analgesic effect, improve mood, and have a calming effect on the central nervous system. As a result, breathing is also normalized, and in some cases, arterial pressure. How to take Validol correctly? The tablet or capsule should be placed under the tongue and held until it is completely dissolved in the mouth. By the way, during the day, it is allowed to take no more than 3 or 4 tablets, and a maximum of 12 capsules or 10 tablets of the drug is considered permissible. How many days in a row can you take Validol? You should not exceed a 10-day course of this medication. In that case, if the expected result is not achieved after a single dose, it is necessary to consider the possibility of taking other medications. This is especially true in situations with pain in the heart area. I emphasize this for your attention. And what can happen if you take medication over a long period of time? In this situation, the condition may worsen and nausea, vomiting, and tearing may occur. Fortunately, such side effects disappear immediately after reducing the dose of the drug. Moreover, you can refuse to take it for a while. Who among us can't take Valium? First of all, people with individual intolerance to its components, and also everyone who can't tolerate sugar, which is part of Valium. Some are interested in the question, is this drug safe for nursing mothers and pregnant women? Often they get nervous and turn to Valium for help. If you take the minimum dose of the drug and not more than once a day, there should be no side effects in principle. Are there any analogs of this drug worthy of attention? Of course. For example, Pangenal and Crotal. Crotal, by the way, is a good preparation, combining anti-anginal, anti-hypoxic, and cardiotonic effects. However, these preparations are much more expensive than Validol. Such accessible and cheap preparations as Validol, activated charcoal, and Citramon are the steady leaders in sales in Russian pharmacies. From my point of view, Validol has undeservedly lowered its reputation among people suffering from angina, dystonia, and neuroses. Many patients suffering from cardiovascular diseases often turn to mildronate for help. But is it necessary to take it? I recommend you watch this video on my channel. Stay healthy, dear friends, and until new meetings.